Gra-
Okay, looks like we're ready. Good morning. On yet another beautiful fall day here in P.E.I. I've said it before, and I think I'll say it again. There's no other place I'd rather be living or working during this pandemic but right here in P.E.I. And I know others have had a chance to express that same feeling of gratitude for the opportunity to live here as well. Today, I have a number of things to touch on, including the epidemiology of COVID in the region, as well as vaccine boosters, the easing of some public health measures, COVID-19 test kits for children, and of course, Remembrance Day. Today, there are no new cases of COVID-19 to report. We currently have 4 active cases and a total of 319 since the pandemic began. This week, the Canadian trends in new cases of COVID-19 are going in the right direction, with a 15% decrease from last week. New case counts were down in most provinces. On another positive note, in Canada, hospitalizations were down 11% and ICU admissions down 10%. Despite these encouraging numbers, on average, over 2,100 people a day were being treated in Canadian hospitals during the last week. So the 4th wave of COVID-19 is still challenging healthcare systems throughout Canada. COVID-19 related hospitalizations and deaths continue to occur mainly in individuals who are not vaccinated. The average weekly rate of new COVID-19 cases in unvaccinated people was 8 times higher than in the fully vaccinated, and the rate of hospitalization was 25 times higher in unvaccinated individuals. Globally, there have been almost 250 million cases of COVID-19 and over 5 million deaths. As of Saturday, October 30th, 93.6% of eligible residents in P.E.I. have received at least 1 dose of COVID-19 vaccine, and 88.3% are fully vaccinated. Last week, 1,729 doses of vaccine were administered, and 23% of them were first doses. Our fully vaccinated rates are above 85% in all age groups, with 2 exceptions: 12 to 19-year-olds with a fully vaccinated rate of 79%, and 20 to 29-year-olds at 76%. I encourage all individuals, especially those under the age of 30 who are eligible to be vaccinated, to make an appointment as soon as possible. To the hundreds of eligible individuals between the ages of 12 and 30 who received only 1 dose, please arrange to get your 2nd dose. Since last January, P.E.I. has reported 220 cases of COVID-19, and 81% of them were not fully vaccinated, and 19% were fully vaccinated individuals. The vaccine provides a high level of protection. However, no vaccine is 100% effective, and it is expected that a small proportion of fully vaccinated people may become infected. When a vaccinated individual does get infected with COVID-19, the risk of disease transmission and severe illness is reduced. The National Advisory Committee on Immunization, or NACI, has identified certain populations who may be at risk of decreasing vaccine effectiveness over time. Individuals who are immune compromised have already been eligible for a 3rd dose. Residents of long-term care and community care are also receiving boosters, provided it has been at least 6 months since their 2nd dose. All eligible residents in long-term care and community care facilities will receive their boosters by November 5th. Thank you to facility operators, residents, families, staff, and public health nursing who have been working together to ensure residents who are at highest risk of severe outcomes of COVID-19 are protected. Last Friday, October 29th, NACI recommended boosters for other populations where it has been 6 months age 5 to 11 years. The vaccine demonstrated very good safety and efficacy during the clinical trials. Once approved by Health Canada, doses of this vaccine will be available in P.E.I. The pediatric vaccine rollout will begin soon thereafter. There will be enough vaccine to immunize all children in this age group. Yesterday, schools began distributing a letter to parents and guardians of children aged 5 to 11, asking if they plan to have their children immunized and the preferred location for their children to be immunized. Public health nursing at Health P.E.I. will consider the important feedback from parents and guardians when finalizing the vaccine rollout plan for this age group. And one more point related to vaccines, P.E.I. will receive a small shipment of Janssen vaccine later this month. Janssen is a single-dose viral vector vaccine. NACI recommends messenger RNA vaccines or mRNA vaccines over viral vector vaccines. However, there are individuals who are unable to receive an mRNA vaccine, perhaps due to a contraindication, and others may have a personal preference for a viral vector vaccine. And additional details about how people can access the Janssen vaccine will be available in the coming weeks. As of November 1st, parents and guardians of children under the age of 12 have access to rapid antigen at-home screening test kits. Over 60,000 kits were made available for families to pick up at various locations throughout the province, including all 8 Access P.E.I. sites. Parents with children attending licensed early learning child facilities will be given a supply of rapid antigen tests by the center staff. Parents and guardians of school-aged children are encouraged to pick up test kits at Access P.E.I. locations. In addition, schools will have a supply of kits to give to parents and guardians on request. As we've discussed at previous briefings, rapid antigen tests are a screening test. These tests should be used if a child has a single mild COVID-19 symptom and does not have easy access to a Health P.E.I. testing clinic. A negative result on an antigen test should be repeated in 48 hours, regardless of symptoms. A presumptive positive result on a rapid antigen test must be confirmed by a lab-based PCR test available at a testing clinic. An individual is only officially diagnosed with COVID-19 after receiving a positive PCR test. I encourage parents and guardians to visit the provincial website to watch a video demonstration on how to carry out the test and learn more about the at-home screening self-test kits. Travel-related cases of COVID-19 continue to represent the majority of cases in P.E.I., with over 77% of all cases to date where we have been able to link the case to travel outside the province. Thanks in part to our border measures that include screening and testing, P.E.I. has not experienced sustained community transmission. From June 27th to October 23rd, 194,000 rapid tests were completed at the points of entry. Approximately 1 in 700 of these tests were preliminary positive, and of these, about 1 in 5 people who tested preliminary positive at the points of entry are confirmed and were confirmed positive by a PCR test. A larger proportion of the point of entry tests were positive beginning in mid-August, which coincided with the emergence of the 4th wave of COVID-19 in Canada. In addition, not all travel-related cases were initially picked up at the point of entry. Approximately 35% of travel-related cases were detected on subsequent routine post-travel testing. Our point of entry testing and follow-up testing continue to be key factors in our pandemic response, allowing for the early detection of cases. The sooner an individual is diagnosed with COVID-19, the sooner they can be quarantined, thereby lowering the risk to other people. As the country and the world continue to manage the pandemic, we are getting questions about travel, especially as individuals plan for the holiday season next month. We are in a much better position this year compared to 2020, with the majority of individuals being fully vaccinated with a safe and effective vaccine. However, COVID-19 continues to circulate in many communities across the country, including Atlantic Canada, with transmission being driven by the highly transmissible Delta variant. For individuals wondering about travel during the holidays, at this point, we suggest that people continue to limit travel while appreciating that seeing family and friends is important. An important consideration when deciding to travel is our own individual level of risk. Our health status and that of others, our vaccine status and that of others, the types of activities or events we will be participating in, and the level of COVID-19 activity in the community. Anyone who chooses to travel outside the province should be fully vaccinated and follow the public health practices in the jurisdiction they are visiting. For visitors coming to P.E.I. or when Islanders return, it will be important to follow the testing requirements and monitor for symptoms. Individuals who travel to P.E.I. from out of province who are not fully vaccinated will continue to be required to self-isolate or work isolate. Given the declining number of active cases in P.E.I., the region and the country, our ability to maintain testing capacity at the points of entry, or really our overall testing capacity, the need for unvaccinated travelers to isolate and receive regular follow-up after arriving in P.E.I., our increased access to rapid tests, and the limited community transmission of COVID-19 in P.E.I. in the last month, we are able to start easing some of the public health measures effective immediately. The personal gathering limit will increase from 20 to 50 people, and cohorts will no longer be required at VaxPass events. However, cohorts at activities that are exempt from the VaxPass, including church services and activities with youth that are 18 years of age and younger, will still require cohorts. The province's vaccination verifier app, the P.E.I. VaxPass Verifier, will be officially ready for download in the coming days. When the P.E.I. VaxPass Verifier app is available, P.E.I. residents will be able to use the P.E.I. VaxPass with a QR code to show proof of being fully vaccinated at the points of entry. P.E.I. passes will continue to be accepted as proof of vaccination at the points of entry. The VaxPass with a QR code validates vaccination status only. Screening and testing at the points of entry will still be required. A P.E.I. VaxPass medical exemption letter issued to allow entrance to activities or events does not exempt an individual from the requirement to isolate after travel outside of P.E.I. Remembrance Day is coming up this week. A time to remember and reflect on the sacrifices of our veterans that allow us to enjoy the many freedoms we have today. Remembrance Day services at cenotaphs and monuments throughout the province are not required to be VaxPass events, meaning attendees should maintain 6 feet of physical distance from people outside their household. Organizers of other Remembrance Day gatherings, for instance, at Royal Canadian Legions, community halls, or churches, must determine if proof of vaccine is required under the P.E.I. VaxPass program. Remembrance Day organized gatherings subject to the P.E.I. VaxPass must follow the relevant public health guidance. And of course, we can show our support and respect for our veterans by purchasing and wearing a poppy. The downward trend in cases in Canada and the Atlantic region is encouraging. The easing of first of some measures is a positive sign that we are able to move in the right direction. And I hope we can announce further easing of measures in the coming weeks. Thank you to all island residents and visitors who continue to be diligent about following public health measures, getting vaccinated, and also getting a booster or a third dose if eligible, wearing a mask in closed indoor spaces, getting tested if symptomatic, and returning from travel, and washing hands frequently and staying home when not feeling well. I think it may have been at the last press briefing I said that P.E.I. just has to hang on a bit longer. And today, I think I'd say P.E.I. is heading in the right direction, and we are moving towards the light at the end of the tunnel. So as we continue our journey with COVID-19, let us continue to be patient and please be kind. I'll end there and open it up to our friends in the media. And I think, I don't know who would like to go first. Dave Stewart from The Guardian.
Just wondering if you can clarify the Remembrance Day if ceremonies, services, they can go ahead pending, or I guess with the 6 feet in play?
Yes. Yes, so it would, I mean, certainly what was discussed with, we started to get some questions, and I had some discussion with the team that these services are not required to be Vax Pass events. So that, and they usually are outside for the most part, but certainly just trying to keep a physical distancing from people outside your household.
Yeah, because certainly the ceremony in Charlottetown can attract quite a crowd, or has traditionally attracted quite a crowd. No concerns there?
Well, I mean, I think it's also difficult to make some of those events a Vax Pass event. So I think
course.
it's really around that recommendation to, keep some distancing from different households wherever possible.
Can you clarify, when you say a Vax Pass event, can you give us some more examples other than churches, perhaps?
Where Vax Pass events are not required at churches, for
Right,
instance.
right.
So, but Vax Pass events would be some of the, perhaps a big hockey game at the Eastlink Center,
Okay.
or Confederation Center. I think there are events that would be Vax Pass. So it's, we're listed really about the areas where Vax Pass is required, and those that aren't, where it's not required. So we were just getting questions about where some of these Remembrance Day services might fit.
And just in terms of the future, a question we've all asked many times, and the public is curious about where we're going and what it's going to take to lift the public health emergency. Our case count in P.E.I. has been down for quite a bit. We've done a great job here. Is it the situation in New Brunswick that has driven this, a delay perhaps in easing the restrictions? Where are we going?
Well, I mean, I think we announced today, a couple of measures, the start of, I think, easing some of these measures. And so what we look at, a range of factors, some of which we listed today, and we'll continue to look at. So our rate of cases per 100,000 over so many weeks, and how does that look here, and also looking at what's happening around us. We're looking at certainly the rate of vaccination, and those who are getting protected, who are the most vulnerable with boosters, for instance, the residents in long-term care and community care. So there's a number of those factors, and I think as we see things start to improve, we certainly want to start easing up the measures. So that's why I think it's quite hopeful sign today, as we start increasing personal gathering limits, removing the cohorts to start with at Vax Pass events. And I think all of us across the country, I spoke to my colleagues in Atlantic, Canada last night. I mean, we're all trying to get through this and keep everyone as safe as possible. And I think we are going to get there.
If I could have just one quick last question. I spoke to a friend who went through the screening process in Borden, had picked up a passenger in New Brunswick, and was told to update their P.E.I. pass, which had an A, and the person was told that they needed a B. Do we need to be updating those things, or?
Well, I mean, I think really what there's going to be different options, and that's really what we talked about. So we have the QR code, your vaccine pass, your Vax Pass is one way now that you can present at the point of entry, as well as a P.E.I. pass that shows that you have 2 doses of vaccine. And really there were certain people who may have had a P.E.I. pass with only 1 dose initially within Atlantic, Canada. So it's try to make sure that everyone's fully vaccinated. So.
One.
Hi,
Morrison.
Jessica from CBC.
That's okay. First question, you mentioned the importance of that follow-up testing, how sometimes the case isn't picked up on the first one and often picked up on the second. So what kind of tracking occurs on people who come into the province from away? Is there what happens when they come in, they get their first test, or to make sure that they go and get their second one, or how does that work?
I mean, I think we don't have we aren't able to follow everyone coming in and out of the province. I mean, and some of these are islanders who may be returning. They may have gone away for a period of time. We're giving that recommendation. We're following how many people are getting tested every week. So we have a good sense that that number isn't dropping off. So I think that's part of it. Anyone who's not fully vaccinated, of course, automatically, we do follow those individuals to make sure they're being tested. Anyone who becomes a close contact, absolutely, then we are following those individuals more closely. But and I think part of it is that we're just trying to message anyone who has symptoms too. It's really important that you might have gone away for the weekend, you felt fine when you first came back, but if you start to get any mild symptoms a few days later, it's important to get in and get tested. And it's something that I think is something that we've been emphasizing in this province more than other places, but it has served us well to try to get these messages out.
So is it mainly on the honor system then, people coming back and just hoping that everyone will do the right thing?
Yeah, and the majority of individuals are identified, of course, at the point of entry, but it's trying to emphasize that especially if you have symptoms, you should at any point in time get retested. But and that may change over time, Jessica, but that's what we've been doing, and that was really in response to we have so much travel within Atlantic Canada, and when the fourth wave was happening and so many cases in our neighboring provinces, we really wanted to emphasize that.
And for my next question, any more information you can give me on third doses? I just want to make sure I'm clear on who would have already received them and who then will be next in line.
So we have been for a number of weeks messaging that those who are immunocompromised, and there's quite a definition of who is considered immunocompromised, that they can go to pharmacy or public health clinics and have boosters. So we know, for instance, last week in the doses that were administered, I think 18% of them that were administered were third doses, so primarily those who would be immunocompromised. Long-term care and community care, that came out at the end of September, that recommendation, so they have been working to start administering those, and they should have all community care and long-term care facilities boosted by the end of this week, which will be fantastic. And in terms of new folks, it's I don't want to forget any particular group, but I mentioned that, so it was 70 years of age and older, as well as those who are either from or living in from First Nations communities, and then also those who've received 2 doses of AstraZeneca or 1 dose of Janssen, who are recommended to receive a booster dose. Again, these are if they've received their second dose 6 months ago. So for instance, if someone in the community is 82 years old and had their second dose in March, they would be eligible to book a booster dose. The other group is healthcare workers who, again, it's been a minimum of 6 months since they had their second dose, but it's particularly for frontline healthcare workers who had that short interval between their first and second doses, so 28 days or less. So a number of our healthcare workers who work in ICU, emergency departments, et cetera, would have had that early vaccine, and probably 21 to 28 days apart, and they had their second dose in January, so they would be also eligible for a third booster dose.
Okay, I think that's all I have for now.
Maybe I'll see if there's anyone on the line.
Louise Martin, CBC. Hi, good afternoon. Nice to see you, Dr. Morrison. I'm wondering if we can get a few more details on the QR codes for the Vax Pass. I know you can download those now and then print them up or save them on your phone. When will businesses be equipped with the scanners? When will that whole thing roll out, and maybe some of the preparedness that businesses are going through right now to get ready for that?
Hi, Louise. Welcome back. So in terms of, there's going to be information I know released later in the week about the Verifier app. In terms of downloading the app, my understanding is that it is available on Apple, and it's going to be confirmed about being also available on Google for Android users in the coming days. And I know they had some meetings, engagement sessions with some of the businesses and organizations last week. There were 2 of them that took place with a fairly large number. So I think the P.E.I. Verifier app system will align with the verification systems in Atlantic Canada, and it'll be available for free in both Apple and Google Play app stores and operated in English or French. And I think there's some information that's on the web or will be going on the web, and there'll be follow-up from my understanding later this week by press release.
And does that, with the QR code and the app, does that mean you no longer have to show identification as well when you're showing that?
No, you'll still be required to have identification, but it will be with a QR code as opposed to perhaps a printed version of your actual vaccine record.
But you'll still need to show like your driver's license along with your QR code. Is that right?
Yes, yes. Now, we were asked a question for certain events if people could take a picture of their ID and have that on their phone along with their QR code, and certainly for certain premises that's absolutely fine. But of course, there'll be other establishments where your actual physical driver's license would be required anyway to be shown.
My other question is just about, right now lots of teams, ringette hockey, are planning to go to tournaments in various places. I'm just wondering about traveling now, particularly for those younger teams under 12, with players under 12. What restrictions should players and families be following? Should they be considering not going, avoid some activities like shopping and going to restaurants, things like that?
So I think the first thing, if anyone, especially young students, young athletes, if they are traveling off island, we've said for a number of weeks now, they should be tested before they go back to school. They need a negative test before they go back to school. And then we are asking young people to be tested again on days 4 and day 8. And so I think that's the first thing that's really important. I think that a lot of the teams are aware of that recommendation. In terms of other activities, I think it's important to remember that in New Brunswick right now, there are a number of zones and areas in New Brunswick that are still in sort of higher risk areas. And I think so there should be some, consideration of when people are, and respecting those areas are higher risk in terms of cases. In the Moncton area, for instance, it's still they're saying only households only. People aren't allowed to have multiple households gathering, and I think we should be respectful of that as well. So I think we sort of talked about it a bit today, Louise, that we have more people vaccinated, which is great. The case numbers are still going down, but there is still COVID circulating even within Atlantic Canada. So we should be careful if we're traveling and follow the measures that are in place in other places, masking, Certainly don't travel or go places if you're sick. Wash your hands, and make sure you're following the testing regimen when you get back to PEI. I mean, someday I will actually get out of PEI too myself, but I haven't left yet.
Me neither. But would you discourage teams from planning any trips then right now, given especially to, as you say, some of those areas like Moncton?
I think it's a really hard question, Louise, and I know my understanding is that there's some discussions ongoing with the teams. We understand, we've always understood the importance of teams participating in games and tournaments, but we certainly want to limit the risk associated with that. So I think some of the questions I've been asked about our tournaments that may be happening the end of November, early December. And certainly if things are going the way they have been in the last week or two, I think that it's looking much more hopeful. I'd feel differently about it than the end of November, if all goes well, than I did a couple of weeks ago. So I think I would I think you have to talk about with the teams, especially those teams that are not vaccinated, what the parents are going to be doing at the tournaments and the guardians. And I think every team may make their own decision.
Thank you very much.
Okay.
Gabrielle Drummond, Radio Canada. Bonjour, Dr. Morrison. Ma question, c'est en français pour vous. Alors, je voulais poursuivre dans le sujet des voyages. Les États-Unis s'apprêtent à rouvrir leurs frontières terrestres avec le Canada et le Mexique pour les voyages non essentiels le 8 novembre. Alors, qu'est-ce que ça change pour nous ici à l'île du Prince-Édouard? Et je voulais savoir, est-ce que ça vous inquiète, ce changement-là aux frontières?
Bonjour Gabrielle. Alors, ça ne change pas grand-chose ici parce qu'il faut, si vous êtes vacciné avec les 2 doses, vous pouvez voyager et puis vous devez être testé ici à l'île du Prince-Édouard aux frontières. Alors, ça ne change pas grand-chose pour les personnes qui viennent ici ou les insulaires qui voyagent. Mais s'il y a beaucoup plus de monde, il y a toujours plus de risques, mais à ce moment, j'espère que les choses qu'on fait d'une façon avec nos frontières va continuer et on va faire les tests et essayer de diminuer le risque avec les personnes qui voyagent, qui sont vaccinées ou non.
Très bien. Et pour les gens qui voyagent, qui veulent voyager pour Noël, pour le jour de l'an, aux États-Unis, particulièrement les snowbirds, alors quel est votre consigne, vos conseils pour ces gens-là qui veulent voyager pendant les vacances?
Alors, à ce point, je dirais il faut faire des décisions avec leurs propres risques. Ils doivent être vaccinés, suivre les mesures de santé publique dans n'importe quelle région qu'ils vont voyager. On sait que c'est important, tellement important de faire les visites avec les familles, les amis, mais il faut faire attention en même temps. Et puis, regardez si vous êtes des conditions médicales qui vous mettent à risque, qui vous visitent, et s'ils sont vaccinés ou non, il faut faire comme un assessment de risque vraiment individuel si vous décidez de voyager. Mais j'imagine cette année, c'est meilleur que 2020.
Okay, merci beaucoup. Bonne journée.
Merci. Bonne journée.
Julianne Lacacher, Radio Canada.
Bonjour, Dr. Morrison. Dr. Morrison, tout d'abord, j'aimerais faire le point avec vous sur ce P.E.I. VaxPass. Comment ça va fonctionner? Où en êtes-vous dans sa disponibilité? Et est-ce que les gens vont être obligés d'avoir un QR code ou ils vont pouvoir toujours montrer une simple photo avec un permis de conduire?
Alors, bonjour Julien. Avec le P.E.I. Vax Pass, il faut, si c'est le QR code ou même si c'est juste le papier qui manque, que vous avez 2 doses de vaccin, il faut montrer quand même une identification avec, pour les adultes. Avec ton permis de conduire comme exemple.
Quand est-ce que ça va être disponible, votre QR code? Vous expliquez que c'est dans les prochains jours, mais on a quand même l'impression que ça prend un petit peu de retard, sa sortie.
Le QR code, c'est déjà disponible. Vous pouvez le download n'importe quand. Ça m'a pris peut-être 2 secondes. Il faut juste aller en ligne et puis en mettre et puis ça montre ton QR code et vous pouvez même prendre comme un screenshot ou imprimer. Alors ça prend pas longtemps. Et puis le Verifier app ça arrive déjà avec Apple et dans les prochains jours avec Google aussi. Et c'est plutôt plus pour les restos et places comme ça.
Docteur Morrison, est-ce qu'on peut faire un point sur la 3e dose, les fameux boosters? Est-ce que vous pouvez nous expliquer, est-ce que vous avez déjà commencé à vacciner des personnes, à donner une 3e dose? Je pense que vous parliez du date du 5 novembre dans les maisons de repos notamment. Parlez-nous du déploiement de cette 3e dose et qui va être vacciné en premier à l'île du Prince-Édouard?
Alors, les 3e doses ont déjà commencé avec les personnes qui sont immunocompromised déjà depuis plusieurs semaines. Et puis, ils ont déjà, depuis les 2 dernières semaines, ça commence avec les résidents de foyers des âgés. Alors, le 5 novembre, c'est là pour les personnes. J'espère que tous les résidents de Long-Term Care Community Care vont avoir la chance d'avoir la 3e dose de vaccin par la fin de cette semaine. Et puis, maintenant, on commence aussi de faire les autres qui ont eu un espace entre le 2e dose et la 3e dose au moins de 6 mois, qui sont 70 et plus. Et puis les personnes qui travaillent avec les personnes qui travaillent à l'hôpital, comme exemple, qui ont eu leur vaccin avec 28 jours ou moins. Et c'est plutôt les personnes qui sont vaccinées en décembre, janvier de l'année passée. Et puis maintenant, il peut avoir un booster. Alors, ça va commencer vraiment. Envoyer une lettre après Nancy a fait ses recommandations, envoyer une lettre à Health P.E.I. et à pharmacie et d'autres personnes et puis alors ça peut commencer.
Est-ce que vous avez des chiffres, Dr Morrison, sur le nombre de personnes qui ont reçu une 3e dose déjà à l'île du Prince-Édouard?
Je peux vous envoyer, mais on a je sais qu'on a on peut envoyer, mais on a 2200 résidents de Long-Term Care Community Care. Alors, je sais, par la fin de semaine, on va avoir donné au moins cet montant. Et puis, on a chaque semaine, on a un certain nombre de personnes qui sont immunocompromised, qui cherchent une 3e dose. Alors, c'est quelque chose qu'on regarde chaque semaine, le nombre de personnes avec la 1re dose, 2e dose et maintenant 3e dose.
Dernière question pour vous, Dr Morrison. Très rapidement, vous parlez il y a de moins en moins de restrictions. Est-ce que, concernant ces restrictions, est-ce que vous voyez dans les prochaines semaines ou prochains mois peut-être l'arrêt des contrôles aux frontières, plus de liberté, de facilité pour aller d'une province à une autre et surtout pour rentrer à l'île du Prince-Édouard? Est-ce que c'est quelque chose que vous voyez arriver prochainement ou pas du tout?
Oh oui, c'est quelque chose qu'on parle, mais j'imagine que ça va durer un bout de temps, mais c'est vraiment pas pour toujours. Je suis certaine de ça, mais on commence à faire des changements avec les mesures de santé publique mais les frontières, on était chanceux vraiment qu'on était une île parce qu'on a eu la chance d'avoir les frontières plus facilement que d'autre part. Alors, c'était important pour l'impact de COVID-19. On n'a pas eu un tellement grand impact de COVID-19 avec les cas ou à l'hôpital. Alors, on va en garder pour un bout de temps, mais pas, j'espère, le minimum temps nécessaire.
Merci beaucoup. Bonne journée à vous, Dr. Morrison.
Bonne journée. I think that's it. Thank you very much.